Richard Buckley here, MilfordMD. Project of the moment is to make the back of the hands younger. We're using calcium hydroxyl apatite, which is Radiesse, a micro cannula. It's not a needle. Hands are actually not numb, just that little entry spot, and our patient is indeed wide awake. You awake?
Absolutely.
Totally comfortable?
Absolutely.
Having a wild time?
Always, all day.
Okay. So I'm laying down little channels of this calcium hydroxyl apatite, which is one of the most robust fillers we have. It has a so-called G prime, or lifting power, of about 1500, and lasts a very long time. How long is that? Years. Plus, it stimulates the body, wherever we put it, to make more native collagen to help further fill in the ravages of time. And we have two hands to work on. It's good because now we have a control. We can shortly look and see the difference between the two hands. Maybe you can prepare some lotion for me over there. So exciting here, you could hear a pin drop. Say we're on pins and needles, except, as I said, this is not a needle, it is a micro cannula. I only need one little entry to get under the skin to put this all over the back of the hand. That indeed was a tiny little poke of a tiny little needle. With time, the skin thins. It's easier to see what's underneath it. So we start looking bonier and more full of tendons, which is not a youthful look typically. Okay, I'm going to stay like that for me a moment. Oops. That red that was there is just my mark so that I know where the hole was. Like that's just little pen mark I made, so I know where. There actually is a little tiny poke there, so that's ready to go with the micro cannula. Kind of hard to see the little poke hole if we didn't have a mark to line things up with. How's the hand massage feel?
Oh, it's wonderful.
That's really what you're going for, right?
I know, you got it.
Yeah. I think if you look at this hand, you can see that this is looking a little smoother than that one. No downtime with this. All right, on to hand number 2. Unless you want to just do one side.
Oh, no. We must be balanced.
Now, we've done this before. And you're back because I presume that you have enjoyed the benefit of it.
Yes.
Yeah. See if we can find our little poke hole. Sometimes not that easy. There we go. You can see there are little blood vessels there. That's a vein right there at the end of the tip of my micro cannula. And I can either go right over the top of it or I can go underneath it. Either way, I'm not skewering it, I'm not poking it, I'm not creating a bruise, and our patient is comfortable. You comfortable?
Yeah, absolutely.
Right. Amazing. This is not numb, only that little poke hole is numb. Amy, are you getting all this?
Of course.
Of course. One of our unsung heroes, Amy, in the background, behind the camera. It's Friday.
I second that.
3-day week.
Ahead of a long weekend, right?
Mm-hmm.
a celebratory weekend. I'm using 2 cc's of Radiesse today. Sometimes I do this with patients' very own fat, an autologous fat transfer or fat graft. I may use 13 or 15 or 12 syringes of their own fat. Sometimes I put some numbing fluid in whatever I'm putting here. Sometimes I use some of the Restylane family of fillers on the back of the hand as well, like Lift. It's a very nice high G prime, or Restylane L. Today is Radiesse, calcium hydroxyapatite. All right. So now I can show you the tip. You see, it's not a needle. It's good I was right about that. Take a little bit of this juice here. We call it goat juice. That's because one of our newer people, once upon a time, is sort of the to-go lotion or cream to help, smooth things out and restore some moisture to the skin. So I asked for the, to-go juice. I thought I said goat juice, so it's stuck.
It was me. Yeah, it was me.
Was it you?
It was me.
So what was that, 8 years ago, 7 years ago?
It was a long time ago. Yeah, that was me.
Yeah.
I was thoroughly confused.
So now it's goat juice. Well, what do you mean? Oh yeah, we take those, old goats and we squeeze them and get the juice out of them and do it right here in the sink. We almost never film in this room. This is actually exam room number 1. And there's 2 and 3 and 5 and 10. And then the OR. Lots of other treatment rooms. 40 lasers. Tons of devices, therapy, thermage, New Era Tight, Legend Pro, Venus Freeze. Oh, it goes on and on and on. And I'm not going to ask you how old you are, but I have to say, you have very youthful looking hands.
For an 80-year-old.
I'm not going to ask you. Right. There we go. So, restoration of youthful contours to the back of the hand using fillers, in this case, Radiesse. You don't have to worry which filler to use, just come in and we'll see what you want to have done where, and we can figure out which tools to use, which fillers to use, which devices to use. Lots and lots of choices. So, thank you for watching another episode of Milford MD.